Hello, I'm Dipti Itchhaporia, and I'm an interventional cardiologist in Newport Beach, California. I'm also the Vice President for the American College of Cardiology. And today I'm speaking at the ACC Egyptian Chapter meeting, which is in conjunction with the Egyptian Society of Cardiology along with FACC. And I'm going to be talking about the top interventional trials from ACC 20 and the World Congress of Cardiology's virtual meeting. There are many interesting interventional trials from ACC 20 this year. A few of the standouts are the first one being the TICO trial, which is a ticagrelor with or without aspirin in acute coronary syndrome after PCI. And the second, I would say, was the SPYRAL Hypertension-OFF Medication pivotal study. And then the last one would be the ONYX ONE CLEAR trial. In terms of the top level findings of these three trials, let's start with the TICO trial. This was with patients undergoing PCI with an ultra-thin biodegradable polymer sirolimus eluting stent for acute coronary syndrome. And these were patients that were randomized to ticagrelor monotherapy after 3 months of dual antiplatelet therapy versus standard therapy. And what they found was that the ticagrelor monotherapy was effective at preventing net composite ischemic and bleeding events. The second trial, the SPYRAL Hypertension-OFF pivotal trial, was an interesting trial where they took uncontrolled hypertension patients that were not on medications, and these were patients that were randomized to renal denervation versus sham. And what they found is at 3 months there was significant reduction in terms of the hypertension in the renal denervation group, with 9.2% versus 2.5% reduction in terms of blood pressure. So the ONYX ONE trial comes on the ONYX ONE CLEAR trial comes on the heels of the global study. Remember, the global study showed that the Resolute ONYX DES was safe and effective in highly complex as well as high bleeding risk patients with 1 month of dual antiplatelet therapy. Now, the CLEAR study is the first study in the US and Japan evaluating 1 month of dual antiplatelet therapy duration in high-risk patients with high bleeding risk. And what they found was that there was a safety profile with 1 month of dual antiplatelet therapy. So these were some of the trials that we're going to be talking about. I think that the take-home messages from all these trials is that there's definitely a movement towards shorter antiplatelet therapy because there's concerns about bleeding, but we're also looking at complex patients at high bleeding risk, and can we get away with shorter dual antiplatelet therapy regimens? I also think that the SPYRAL hypertension trial, again, has sort of repiqued our interest in renal denervation, so more to come with all of that.